The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. We continue our shows from the administrative offices and wish our friends at WHPC and our listening audience continued good health. Our guest today is Nan Gamble, Executive Director at the Inn at Belden Village. Nan, welcome to the show. Thanks for joining us. Looking forward to talking to you today.
Thank you, Paul. It's great to be here.
On so many levels, each of us are impacted by the coronavirus and all of the changes in our lives that are required to keep each of us safe and healthy. For those in nursing homes and assisted living, the level of urgency is magnified beyond most of what we can imagine. Residents of long-term care facilities are the most vulnerable to serious illness or death from COVID-19, and they live in a congregate setting, further increasing that risk. While this is daunting, it pales in comparison to the social distancing that is required from their family and loved ones. This morning, we're going to talk with Nan Gamble and discuss the extraordinary measures that the staff at the Inn at Belden Village and all of the other local facilities are taking to keep their residents safe and as connected as possible to their loved ones. We'd like to remind our listeners today that this program is available on our podcast, which can be downloaded from the App Store in your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like to address today, post it up on our live Facebook feed, and we'll address them as we can.
Okay, Nan, welcome back. We're pleased to have you as a guest today. Please tell us a little bit about yourself and your background.
I'd love to. As you know, I'm Nan Gamble. I'm the Executive Director of the Inn at Belden Village, and I had the honor of founding the Inn with my father-in-law and husband and Joe Langworthy in almost 20 years ago now.
Wow. So please introduce our audience to the Inn at Belden Village and share a little bit of your history as well as what makes your facility unique and special in our market.
As I said earlier, we did found the Inn 20 years ago. It was the vision of my father-in-law, C. Herschel Gamble, to build a community to care for our seniors in a way that God would be proud of. He talked about it for almost 20 years and really worked to try to find a way that this church could afford it. We call it our miracle on 38th Street. We were able to hook up with a businessman in Columbus 20 years ago that had a very successful formula for assisted living and hired him to train me to be the administrator and to help us build our community. And with the Lord's help and our amazing staff, we've been able to be successful for these 20 years. We provide care all the way from an independent level of care to people who just don't want to live alone anymore but still can drive their cars and take care of themselves, to end-stage life on hospice where we need to provide everything for them.
So we're all really weary of this social distancing and the anxiety that both knowns and unknowns from this virus are causing. Yet our nursing homes and assisted living facilities were among the first to be restricted back in March. So, Nan, can you walk us through the timeline of the guidelines and restrictions that are in place for resident safety?
Sure. I think one of the greatest shocks I've ever received when I heard the news about the nursing home in Washington State that had such a devastating outbreak of COVID-19. So that news is coming forth through the media before we're ever getting restrictions from ODH. And our board immediately met and began talking about protocols. We are blessed at the Inn at Belden Village to have a friend that works in the federal government, and he called us and he said, listen, I can get you a sanitizer that they're using in the cruise ship ports and in the airports that will kill this virus for up to 30 days, and you can apply it and then every 30 days do it. So that was our first, here for us, that was our first line of defense. But the first thing that we were required to do by Ohio Department of Health and our local Stark County Health Department was to restrict visitation, obviously, to one visitor a day and to begin screening everybody that came through our front doors. We took their temperature. I think everybody probably has this next thing I'm going to say memorized. We asked them, do you have a cough, a sore throat, shortness of breath? Have you been in the presence of anybody with COVID-19 in the last 14 days? Have you been on a cruise in the last 14 days? Have you been in a hospital in the last 14 days? And have you been on an airline? And that's just become our mantra 100 times a day since mid-March to everybody that comes in the door.
Play at the beginning or what?
Yeah, I'm telling you. So that's the beginning. Then shortly after that, we went to the 6-foot distancing of our residents. For us, we're blessed to have a very large community with large open spaces, so we were easily able to move our dining room into our commons area, not put more than 2 people, at a table, keep them 6 foot apart in both of our environments. We serve a memory care residents, people with difficulties with memory as well. So we did that, and then pretty soon we got notification, of course, that no entertainers, no outside things like that could come in for the residents. So we shut all that down and got really creative with the activity program. We can talk about that a little bit later. And then it got minimized to no more than 10 people in a gathering. So then we changed the activity programming again to small groups of people multiple times a day and hired new staff to help us execute all of that. And then it moved to no visitors at all. Only the most critical healthcare providers, whether that's lab technicians or hospice personnel that come in and help us care for our residents, and if somebody is at end of life, allowing one visitor a day for that family. That's incredibly hard. And then we began to mask our own people because they're going home at night, getting exposed to others that might be either a second-hand or a first-hand exposure, and making sure they didn't bring anything back in here. Of course, we're checking symptoms every single day, and at the same time we were masked, the government had us start checking temperatures at the end of the shift, because somebody could spike a temp in the middle of their shift or symptoms, and they wanted to know before they ever leave who did they come in contact that day so we could mitigate and isolate. All along, anybody that had a fever, had a cough, had a sore throat, and for the Inn at Belden Village, any sick symptom at all, we isolated for 14 days in the room. That's impacting. We did it for our staff, too. If you came in with a symptom or a fever, then you stayed home for 14 days. And that brings us to present day, and now we're checking our residents' temps every single shift.
Wow. So, one of the most difficult decisions in life is knowing when a loved one may need assistance, and that decision is complicated by this pandemic. So, how do you assure family members that despite this pandemic that their loved ones are safe and okay?
I think in partnership with ODH and our local Stark County Health Department, as well as the other protocols that I described earlier that we've put in place for sanitizing, for me it was just a matter of communicating, calling our families, letting them know what's going on, everything that we're doing to keep their loved ones safe. We have been blessed, and I don't take full responsibility for that because this disease it doesn't discriminate where it breaks out. But we've been blessed not to have an occurrence of it. We did have a second-hand exposure just this week, and by the time we were notified by the health department, it was already on the 10th day, so we just had to isolate residents for 4 days, and we're so grateful. Of course, we called families immediately. We explained all the details of it, and today there's absolutely no symptom breakouts, thank goodness. It was a hospice worker that had no idea that she had been exposed until she broke symptoms out about 5 days after being here. But we all take, extreme measures just to make sure nobody gets sick. So I think communication is the most important thing. We're using FaceTime a lot, running around with Jonna Purvis, our marketing director's cell phone, so that if families want to see their loved one and talk with them, they can. That's been interesting because it's kind of a foreign concept for a lot of our residents, so they really would rather just talk. they get really confused sometimes by the video. Not all of them, but some of them. We've even had some families ask, can we come to the windows? And we'll say, if you keep a 6-foot distance and put on your mask, sure.
Amazing. This has to be extremely challenging to operate a nursing home and assisted living in this environment. How do you relax?
Oh, my goodness. I don't know if I have yet, but that's good. It keeps me sharp. You know what? I pray. I spend time in the presence of the Lord, honestly, to find my peace. I always have. And it's where I put my hope to through this crisis, just every day praying, doing everything we can in the physical and the natural, but praying also just the Lord will keep each and every one of our staff and our residents safe and well.
You know, I talked to another nursing home administrator a few days ago. He's working 14-hour days, 7 days a week. I mean, that's got to be something.
It is, and I have a feeling that most of us are. I've had some days that weren't 14, thank God. But when you're isolating your staff at the slightest of symptom for safety, somebody's got to be here to work the floor. And so that's what you do to make things keep going.
Okay, Nan, we got to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Welcome back to Health Matters at the Medicine Center Pharmacy. Brad and I are talking with Dan Gamble, Executive Director of the Inn at Belden Village. Have a question? Post it on our live Facebook feed.
Okay, Nan, can you explain some of the mandatory guidance that CDC is requiring for your facility?
Sure. As I said a little bit earlier, we've got to screen every person that comes into the inn at Belden Village. We have to restrict all visitors. That would be not our support medical staff. You know, we have to have hospice workers that come in. We have to have lab technicians that come in. We have to have x-ray techs from time to time that come in. We can only have maintenance personnel if it's a critical repair to the operation of the facility, but all other visitors are restricted unless it's an end-of-life situation. We are told to sanitize multiple times a day and to increase this. I mean, you're always sanitizing in the healthcare community, but they want that top of mind, obviously. And then our staff have to wear face masks during their duties. If we had a COVID infection in our facility, there's a whole nother set of regulations. We've been blessed not to have one. But if we even have a symptom, we treat it like it is the COVID virus. We isolate the resident. We deliver food on all paper. We put biohazard waste cans inside the room so that when we put on the PPE, it's all discarded inside the room and immediately the worker sanitizes before leaving the room. You're just doing those extra precautious measures to make sure you don't spread it. In all reality, though, those are our daily requirements. We treat every disease, every virus as though it's infectious, and so we're used to isolating people to prevent outbreak of disease. The flu, I mean, prior to this, every season we have to ramp up our sanitizing. We have to ramp up and make sure we're top of mind on infection control measures. And then, of course, the 6-foot distancing rule for our residents. We even do it on breaks for our staff. We've spread out our break room for when they eat together, because obviously you got to take your mask off to eat, right? And then we have to take their temperatures, as I said, and screen them when they come or anybody that comes into our building and when they leave. And then we take our temperatures of our residents and monitor their symptoms every single shift.
So we know you're subject to surveys and inspections. How do these restrictions exceed your normal compliance measures?
Clearly, the no visitation, the 6-foot rule, the checking symptoms at the door. I will say, and I might get in trouble for saying this, but I've thought to myself, why didn't we always do this every flu season? How much sickness could we have prevented had we done this? It's costly. I mean, we've had to hire. That's an additional, for us, 18 hours a day of somebody to just sit at the door and check symptoms. You know, we've hired 2 additional activity personnel to help us execute activities and maintain the 6-foot rule and not exceeding more people than we should have in one area at a time. So those are additional compliance measures. I will say that ODH and the Stark County Health Department have been amazing. I get emails every single day, updates, the communication for what we're supposed to do and how we comply has been phenomenal. I don't particularly love all the surveys we have to fill out daily, but it's a good thing. They're trying to track PPE and watching us so that if we're getting close to running out, they're keeping a handle on it throughout the state. So we do have surveys we have to fill out every single day. They have stopped most of our surveys, physical surveys, because they don't want the surveyors in the building, but they're only, right now, they're going in for very extreme problems and for outbreaks of the virus to manage that.
How do you handle the physical therapy and that sort of thing? I know you have a complete sort of facility there to do it.
We do. That, because we feel like that's a necessary medical service, they're masked. They actually have masks for the residents and masks for them so that when they're in that close proximity, they can take care of that resident safely.
So that room...
And we sanitize that equipment daily, you know.
So you one person in that room at a time, or?
That we moved our physical therapy to a bigger room, and they've got enough space in there to space out. Okay. But they typically don't have honestly, that is legacy therapy, and I'm just doing this by memory, but I don't think I ever see more than 2 therapists and 2 residents at a time in that room.
Okay. Interesting.
Well, it has to be challenging to keep on with what your normal schedules and routines are on a daily basis and trying to keep your new normal. It's probably a challenge.
It is challenging. We did a lot of things like we have some beautiful placemats that we sanitize every meal, but when this started, we went to paper. You're just going to do anything at all that you can to throw it away and make sure there's no additional infection contact. The residents have been amazing. They thank me all the time. We see what you're doing. We see how hard everybody's working. We want you to know how much we appreciate that you're doing this to keep us safe. And I know, and I'm sure with their families, there's tears and they're missing them. But I honestly hear more gratefulness than complaints, which is just a tribute to our residents.
Well, that's encouraging to hear.
It is. I guess my last question before the break would be, are they afraid? Are they fearful? Or as a general, there's so much stuff on the news every minute of the day.
There really is, and that has surprised me that I don't see them more afraid, and I think it's because they see that person at the front door checking everybody, like they see an increased security, and they see the masks on the staff, and they see the isolation boxes outside of rooms, good or bad. And so I think they realize that we're doing everything possible. I've had people say, you know what, I think I'm actually probably safer here than I could be anywhere. And so I think just because of what they're seeing, they're getting a little bit of peace and assurance. They do sit with us, and they watch the governor's 2:00 messages some days, and I think that's even been reassuring and a confidence builder for them, that they feel like everybody's looking out for their interests and safety.
Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The Half Off and Out Buy store in Louisville is open. That's right. It's open, and it is really open. Usual hours. We've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need Sea Glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass, open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing the impacts of COVID-19 on assisted living and long-term care facilities. A lot more to cover this morning, so let's get back to the show.
All right, Nan, your facility at the Inn at Belden Village is both beautiful and bustling. I know that you frequently have on-site entertainment, visits from family members and loved ones, and even field trips. How are you managing entertainment and activities during this time of isolation?
We are so grateful. We remodeled our facility in 2016, and with that remodel, we installed 10 75 and 80-inch flat-screen smart TVs and Apple TVs. So now we can quickly hook into YouTube and all kinds of apps. So we have been going on a whole big series of outings to zoos, to museums. It has been fabulous. Even with Google Earth, we can tour Europe. So we've been doing and planning those kind of things. We've been to Pavarotti concert. We've had all kinds of different things like that. Debbie Brindeck, our activity director, has been, and her team, incredibly creative. And they are very happy. It's like they're not missing it. I have on standby the Gamble family because we all work here, so we're employees, and they're incredibly talented, but we haven't even needed them. They're enjoying the TV and the different tours that we're taking there. We're doing a lot of different creative things, some that we haven't even done before because we've had to think out of the box. And I think because it's fresh and new ideas, it's forced us to step up our game. It's made it even more enjoyable. They really, we had to space out bingo. They would not hear of no bingo. So we're sanitizing cards and chips regularly. The card games have been set at a table. Some of the residents, we have a euchre club, and they did not want to give up playing cards, So they've got 4 bottles of sanitizer on their table, and they're spread out about 6 foot apart, and they're throwing the cards down the table, but they're still playing. So we have not went, I know some facilities have went to a complete isolation in the rooms, and we looked at the advantages of that, and we felt like because we were not required to do that unless there was certain outbreaks, we felt like the emotional impact of that would be as significant as being sick long term. So we've just kept to the 6-foot distancing and the minimizing.
I heard one of the facilities was doing hallway bingo where they sat in their doorway.
I've heard that.
Speaker system, because the hall was really long, so apparently they had a speaker system that would, everybody could hear the numbers called. So it's kind of interesting,
Very creative. That's awesome.
Well, I have to speak to your TVs and your Apple TVs and smart TVs and stuff. It's interesting because we recently cut the cord at my house, and it's been a blessing to be able to access a myriad of things on your big screen that you normally only get on a computer. So I can see how that could really give you some extra tools. And I like your tours of zoos. That's pretty cool.
It was fabulous.
Some of that stuff probably feels like you're there, which is really exciting. So,
we thought it was really neat. And you can take tours, tours to different countries the same way. So it's been actually fun.
Neat. That's really neat. Well, we've also seen heartwarming images on the news and social media of family members finding creative ways to reach out to their loved ones. Before the break, you mentioned a couple ways. How about sharing some of the experiences you've witnessed at the inn?
I've seen a lot of cards letter writing. We talked about the Facebook. We've seen somebody stand outside the window with a baby, a newborn baby, and just make sure they got to see this new member of their family. This has nothing to do with long-term care, but I'm going to say one of the neatest things I saw. You know how churches, because my husband is Pastor Dana Gamble, and how we have all had to go to creative services on FaceTime or however live stream, all the different ways, parking lot church. Well, one church in Georgia, the secretary had the members come by and drop off posters with their pictures on them, and to surprise her pastor on that Sunday morning, she went out and put all their posters in the pews so he wasn't preaching to an empty congregation. I thought that was pretty creative.
I like it.
At least you're talking to somebody, huh?
Yes.
It's a sign. Okay, so what can our listeners do to help and support both your residents and staff?
I think for family of residents, even though they can't visit, just staying in contact with their loved one by the phone, reassuring them that they're still thinking about them, that they're not forgotten, that they can't wait to see them again. Cards, we're sanitizing every piece of mail that comes in here, but we're still giving it. So cards, I know there's pros and cons to the 6-foot rule at the window, and I'm sure that could get us in some trouble extensively. But sometimes when we have a resident that is extremely upset, I'll call the family and say, hey, why don't you come? We're lucky to have a service road that goes around the outer windows, and you can even sit in your car and talk to some of the residents. So I just think staying in contact somehow is important, letting them know that you think of them. And we just go around saying, your family misses you so much, and they're going to be here as soon as this thing lifts, and reassuring them that it's not just them. This is worldwide. It's not just us that are in this predicament. My grandmother always said, when life gives you lemons, make lemonade. I'm sure you've heard that saying. So we remind our residents of that. And my father-in-law, he used to always say, in very, very tragic times of trials to members of our church, it may never be the same, but it's going to be okay. And he always says that this mountain is nothing to climb for a stepper. And it's true. If you can just change your perspective and think I'm an overcomer instead of I'm defeated, it makes all the difference in the world.
Well, how about, you mentioned your staff members. I imagine the responsibility and stress they're managing is substantial. Clearly they have a passion for their residents. But what are you seeing, and how are they experiencing and handling the situation when it's probably extra challenging on any given day?
It is. Many of our staff members have families, have children. The fact that they're leaving their home and going out into the community and then coming here puts them at risk. It does, every single day. And the last thing they want to do is take home a virus to their family. So we talk to them about the importance of infection control. And if you just observe what we've always been taught in this industry of good hand hygiene, and I don't know about you guys, but I keep a bottle of sanitizer in my car at all times so that every surface we touch, we're sanitizing again. Yes. And thank you, because you all have been so generous with us, bringing us some of that too. Thank you. And so we gave them small bottles of sanitizer, that just have on their belt. We put antibacterial soap and have kept it supplied in the resident rooms, of course. Outside, the rooms are quarantined. Just the fact that we've been able to supply them and keep our PPE stocked all of this time has been huge for them too. And I hope they realize the sanitizer, the sanitizing process I told you that we were so blessed to have was still $7,000. The PPE we have cost us $25,000 to date. So we're making huge investments to try to keep our staff and our residents safe. And I'm hoping that makes a difference to them.
So we've probably covered this already, but can you walk us through screening procedures for residents and staff? Maybe.
Yeah. we're walking into spring in Ohio. And this has been one of the hardest things for me, because how many of us don't have sinus things right now, or little coughs because of all the pollen in the air? But we're not taking any chances. So if you have a sore throat, no matter the cause, if you have a cough, if you have a fever, and it's not all three symptoms, it's one, then we're sending you home. And we're going to leave you there until that resolves. That's tough on everybody, staff alike, but we're strict to that, and the temperature taking, and we're just no nonsense. I had a nurse, and some days you're a little desperate, and they're like, "Oh, it's just sinus. I'm sure it's sinus." I'm like, "We don't have a COVID rapid test here. We don't know if it's sinus." They're going home, and we're going to all pitch in here, and we're going to make this work. And that's the same for residents.
Well, what are you hearing from the government? Like, will every nursing home have their own coronavirus testing device, or is that not even been talked about yet?
Not yet. No confirmations of that. I will say that Rite Aid started sending out texts to some of their regular customers and some of the other places out there that are saying that their pharmacists are going to begin doing some rapid testing, but I haven't actually seen the reality of it yet. One of my greatest frustrations through all of this is not being able to get the testing, and I respect how difficult that's been. I'm not pointing a finger at anybody. But, for instance, I had a grandmother that helps take care of her grandchildren that works for me. She's a full-time employee. She had to take him to ER. And when I called, it was a hospital in Youngstown, and when I called them, they did not have any separation policies for people when they came into the ER to separate somebody that potentially had COVID from the rest of their ER population. So I had to keep this very valuable employee off for 14 days. I barked up every tree I could find to get a COVID test, and I couldn't. She just had to be off for 14 days.
And, you speak to that, too. We've been getting emails at the pharmacy every day, and, buy our test, buy our test, buy our test. I'm talking to other pharmacies, and they're finding that tests they're bringing in either take a week to 10 days to get back, or they're not getting good results in the quality of their results. So I agree with you. I wish we could offer a test to the community today, but I have been very frustrated in helping people find a solution that we can have confidence in.
I totally agree. I've read a lot that says there's a lot of false negatives and false positives. And to me, that gives you a false sense of security, and we're almost better off just waiting 14 days.
Yeah. Well, if you
as
mobilize,
hard as it is.
If you mobilize and you're getting false tests, the test just makes them, that's of no value. It makes things worse.
It is.
I think we're at commercial time here, aren't we, JD? You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The Half Off and Out Buy store in Louisville is open. That's right. It's open, and it is really open. Usual hours, we've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, Please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us today. And so let's get back to the final portion of the show. So, Nan, even though this is a challenging time, there are bright spots and surprises that some changes we may have dreaded become successes. What is surprising to you and perhaps prompting a change you hope continues long after this pandemic ends? And how would this... How did all of this, or will all of this, change your procedures in the home nursing homes and assisted living facilities?
I think one of the ways, just looking at the benefit of the screening at the door, although it's extensive, although the protocols and the PPE required are expensive, I can see in seasons of flu in general that's going to be ongoing. And it is a good thing because it's just an extra measure of protection for your residents because this is silly, but I picked up I'm going to tell on myself and my facility. I picked up a ketchup bottle this morning. I came in at 5 to help them set some things because we did that sanitizing process last night. And so everything had to be reset this morning, and picked up a ketchup bottle that wasn't washed. And I said, everybody get over here. This is like loading a gun and aiming it at a resident because that is contact contamination. You have to sanitize every single thing on the table. So I think we're going to have that top of mind awareness now as a general population. My people are trained on infection control. They're trained on PPE. Before this, who even knew what PPE was, besides those of us in the industry? So I think in general, we're all going to be better for it. I have a 4-year-old and a 2-year-old granddaughter, and they love Daniel Tiger, and they are going around singing, wash, wash, wash your hands, wash your hands. And then they're going around saying, when you're sick, rest is best. When you're sick, rest is best. And I just think, wow, thank God for educational programming that does make us all better. The other thing, when you talk about bright spots, I always say what doesn't kill you makes you stronger. And even for those that have been infected, I've heard some people saying, even as we start loosening the reins on this, our bodies have to sometimes get sick to build resistance. And so just looking at, even if you were somebody that got sick, the fact that the next round you're going to be stronger and your body's going to fight it even harder. And then the other bright spots is just pulling together, community pulling together, families sending in pizza from providers, sending thank you cards to the staff. I've probably seen more show of appreciation in this season from multiple people, and kudos, Paul, to you and to Brad, even you guys checking on us and bringing us PPE that you had available and candy. That's just been fun. So thank you.
Well, I happen to have acquired a large amount of chocolate candy. Does that interest you in any way?
Always. I never turned down candy. I will tell you that we are in the nursing homes denying homemade things.
Yeah.
Because you have to know that it was done under health department regulations and followed by proper protocols. But yes, always loved chocolate.
Okay. We'll send you some hearts.
I will say I've gained a few pounds, and that is not a positive bright spot of this coronavirus.
Maybe you're locked in the home. You can't get out and walk and run and all that other kind of stuff, you know.
It's just like comfort food, isn't it?
It really is. Nothing like chocolate, for sure. Nothing like that. So I don't know where we are.
Well, Nan, do you have a final closing message for Goodwill for your community at the end and the public to let them know how what your inspiration is for the coming weeks as we continue to get through this?
I did, to my coworkers in the community, I would just say thank you. Everybody's working hard. When the public looks at a community that has had an outbreak, I would say don't sit in judgment. This thing is no respecter of persons, and people have to uphold strong infection protocols and do everything they can, but just by no fault of their own. There can be an outbreak, and when there is, I would say to people, be strong, be encouraging, do everything you can, especially in the community. If you're a healthcare worker, don't go to work sick. Don't take any chances with the lives of these people. And then most of all, my father-in-law, Bishop Gamble, used to always say, whatever is not of faith is sin. Don't let fear take control of you. Just know that we trust the Lord, we do everything we can, and we put our hope and our trust in Him, and He will bring us through this. We're strong. We're built strong, and we can overcome.
Well, I'd like to give a shout-out here to our healthcare workers, and including yourself, Nan, and your staff, the doctors and the nurses. I read an interesting article in yesterday's Beacon about the people from Ohio that went to New York to help out. And it is a grueling event what those people are doing, and helping the people in New York. So good for them. So thank you to our guest, Nan Gamble, Executive Director of Unit Belden Village. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we will see you next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists, Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.